Sometimes nurses attend our London courses from as far away as Glasgow, Cardiff and Portsmouth. Thank you. Sometimes nurses would like to attend our outstanding OSCE courses but for various reasons can't make it here. It's okay, we hear you. Here at IELTS Medical, we're currently working on reaching every nurse wherever you are in the world. In the meantime though, we've got our video course and textbook package called The Ultimate Guide to the NMC OSCE. Your guide includes the theory for the exam, as well as vouchers for 1 or 2 6-hour sessions with our OSCE educators. Grab your ultimate guide at oscenurses.com today.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Hi, I'm Grace and I'm a Band 6 nurse in Adult Intensive Care unit here in London. If I think about it, my entire journey of being a UK registered nurse was very challenging. Believe me, it really was. I arrived here in 2017, April 28, 2017 to be exact. So I'm nearly 4 years by the end of the month. I was 24 by then, so yeah, nearly 4 years here in UK. Actually, here in the intensive care, the process is quite different. You have to complete 1 year of stay in the unit, and then you should have completed as well your step 1 competency, which is basically what they give out. You have to take some procedures you do as an intensive care nurse, and then when you complete that, plus if you have 1 year of experience, you should apply for an intensive care course, which is of course a lot of people are vying for that. Say for example, if there are only 6 spots or 6 free spots that they can offer, then you have to compete with other people as well. So you have to undergo for an exam. I did undergo for an interview, and then when you get selected, I did go to school, do a postgraduate intensive care unit course. That time it was in University of West London. So I completed that, and as soon as they have announced vacancy for the Band 6 post, I did apply straight away. So that is how I transitioned from Band 5 to Band 6. Course is actually 2 modules, so all in all it's 6 months, 6 months. For me, to be honest, I find it difficult because the first module is more or less you will be graded on 2 things, an exam and on essay. So I did not do a masteral course in the Philippines. So how they grade it here is that everything is evidence-based. So you have to read a lot. You have to back up the things that you write in the exam as according to whoever is saying that in the book. So for example, it's not like a multiple choice stuff, or it's not enumerate those kind of stuff what were used in the Philippines. So it's an essay. The exam is an essay. So they will just give you 3 questions, for example. There are 2 levels, by the way. There is a level 6 and level 7. So level 7 is what I did enroll last time. So that will give you a pathway to masteral in case you want to. So in level 7, they gave us 4 questions, and you have to answer that in an essay form. And it's not only like you answer it based on what you know, but everything you should say is based on intensive care society, intensive unit care, a society of intensive care units, something like that, according to British Thoracic Council, something like that. So it has to be backed up with data. So I really did find it difficult in that sense. So yes, it was difficult. For example, in our group who did the course, it was like 7 of us, and it took some time, like more than 6 months before the unit announced vacancy for Band 6. So when we applied, it's not only all of us, all of us in the batch for the course, there are few people as well who did the course before, the backlog, or some people who did not get the band 6 post before. So I think it was a total of 11 applicants. So we have to get support from our team leader. They should endorse you in a sense, and it should be part of your appraisal. So in UK, we're doing yearly appraisal to your team leader. So it would be a plus if you've mentioned it before the last time you did the appraisal, like you want to progress, you want to be a band 6 soon. So they will take that into consideration. So we were interviewed by the matron, one clinical facilitator, one practice educator, and one band 7 team leader. So 3 of them interviewed us, and they did not announce that time how many are they getting out of the 11. So we don't know, because usually they only get 3 or 4. So there's really a lot. But in the end, it was a good thing because they got 9 out of 11. So, which is very good. So, Isa, you have to go through that. If you're a 6, if you're in the bay, you're expected to lead the other 3 colleagues. So you should parang nurse in charge ka din, in a sense na if what's their problem, you should be able to sort it out for them. Parang they won't run outside. You're fixing the things in your bay, parang ganon. Kapag ganon, parang nagde-decide ka na hindi mo na kailangan magtanong sa doktor. So parang minsan you just have, if you're confident enough, for example, you can change ventilator settings on what you want. Like if you know the blood gases, you can just go ahead and change ventilator settings, top up this, give that. So parang you should in a way earn it. Kaya parang hindi nila binibigay talaga ng automatic. Parang ganon. The very first advice is really, it may sound cliche, but always believe in yourself. Kasi it's like you will hear a lot of critics everywhere, but if you listen to all those, you will never progress talaga. Kasi in yourself sometimes you will have doubts, but your desire to progress should be stronger than your fear and your doubt, and you will really believe in yourself if you have confidence. And how can you get confidence? You can get it by performing well in the unit, and you should learn continuously as well. You should be assertive and be engaged in the senior team, for example, engaged in your unit, and time will come that you will earn the confidence. So don't be too hard in yourself. If it's like your first year in the UK and you don't still feel confident, it will really come. You just have to use the resources available to you. For example, there are a lot of Filipinos in higher rank. So make use of your ates and your kuyas to ask questions, and always be assertive to learn things. And then and I think going back to what I said about criticisms everywhere, because you cannot avoid that, you just always have to remember that in anything, there's always a 50% chance of winning or losing, or progressing or staying at the same point forever. So you should just really take a leap of faith. And if you think that you're not ready, you should remember that you will never be ready anyway. So you just have to go forward. And as what my ates were saying as well, you should take the chance while you're young, because you wouldn't know that it may take you places. And I think one important thing too, the practical ones, is when you have the opportunity, of course, grab it, the earliest opportunity, and do good in the interviews. I think as a couple of years of stay here in the UK, I've really seen that it's, aside from how you practice in actual life, in real clinical area, it's a big thing to do good in interview. And if you want to progress from band 5 to band 6, I think when you go for interview, you should answer questions as a band 6. That is one of the tips that was given to me by the senior ates. They said that when they ask you questions, you should already think that you are a band 6 now. And lastly, just pray and don't be too hard on yourself. Work hard and play. How do you call that? Work smart, not hard.
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.